We'd like to take you through a cataract operation from start to finish to show you what is involved when we remove a cataract. Cataract surgery is done by numbing your eye with eye drops. There's absolutely no pain during the procedure, and patients are very comfortable. We make a small incision into the eye and inject some more anesthetic solution to keep you comfortable. Patients are usually incredibly comfortable during this procedure. We next put in some very thick viscous material to help protect the back of the cornea during the manipulation that is done inside the eye. A larger incision is then made to introduce additional instruments that will be used to remove the cataract. Cataract is like a peanut M&M, and it has an outer shell that must be opened in order to gain access to the cataract. We do that by making a very small round tear in what is called the anterior capsule of the lens, or as the peanut M&M analogy would describe, a opening in the shell. We try to make this nice and round, and this is a very important part of the procedure that must be done very carefully. Again, the patients are very comfortable during the whole procedure. You can see there's no movement even though the patient is awake and having no discomfort at all. Once the opening in capsule is made, what we like to do then is inject some fluid underneath the opening to dissect the lens off the back of the capsule. So we inject some fluid, and you're going to see a fluid wave that happened very quickly. And you'll see now that we're going to rotate the lens and make sure it's nice and mobile, and this will allow us to better remove the lens with the ultrasound device. Cataract is removed with an ultrasound device that vibrates back and forth at 40,000 cycles a second. It's very, very quick, and you can't see it. There are lots of different techniques to remove the center of the lens, which is like the peanut of the M&M. Many people just like to divide the lens in pieces, like a piece of a pie, and then you can just remove each section of the pie, and the lens, the body of the lens is removed. You see here that we are just dividing the lens into tiny pieces. This is a fairly dense cataract. You can see by the brownish color of the lens that it should be clear lens. It should be nice and clear for a person to see through, but because it's so dark yellow-brown, you can appreciate that this patient is not seeing well. Now that we have the lens divided, you can see how easily the pieces of the lens come out. This is the hard part of the lens, called the nucleus. The analogy is to the peanut in the peanut M&M. And it comes out very nicely in tiny pieces. And in a minute we will see that the lens has been completely removed, and it is now just surrounded by some soft gelatinous material called a cortex. Again, the analogy to the peanut M&M is that this is the chocolate that surrounds the peanut. We actually cannot use the ultrasound device for this, so what we will do is use a different instrument that just irrigates fluid and aspirates, much like a vacuum cleaner. And we are trying to get a very clean space with no lens material left behind. You can see how nicely this soft gelatinous material just pulls away. Our goal is to leave the posterior capsule intact, the posterior membrane, which will act as a bed for the new lens to sit on. Here's the last piece coming out. And the side now looks about ready to put the new lens in. You can see the difference, how nice the red reflex is compared to what it was prior to when we started, when you couldn't see any red and all you could see was the yellow-brown cataract. In order to prepare for putting the cataract in the implant in the eye, we are going to re-inject some viscous material, and this now opens the space between the anterior opening of the capsule that we made and the posterior capsule, and creates a really nice space for the new lens to sit. Right now we're just polishing the posterior capsule to get some remaining cells off of the posterior capsule to help have a very clean visual axis. There are the last remnants coming up. Now comes getting ready for the fun part of putting the new lens into the eye. The new lenses are very ingeniously designed so that they will go through a very small incision, and once in the eye they open like a taco. Here we just put some more viscous material in to make sure we have a nice space for the lens to go in, and you're about to see the lens being pushed in through this inserter, and as it comes out of the inserter it unfolds into the space. Now watch it unfold. I do this slowly. The center is the optical part that you see through, and you see those little foot plates that have to be pushed in position, and those center the lens and keep the lens in the proper position. The nice thing about these lenses is when they're sitting properly, there are no stitches that are involved to hold it in position. It's more of a spring that allows the lens to center perfectly, and as you can see, this lens is now positioned beautifully in the eye, and it looks terrific. And this patient will see a very big difference from the preoperative vision that they had to what they'll have after the surgery is complete. What we're doing now is just hydrating the incision with fluid. The nice thing about these incisions is if they're done properly and constructed in such a way that they do not leak, we do not have to put any stitches in the eye at the end of the case. That helps greatly because patients are a lot more comfortable with no stitches, and we don't have to take any stitches out, and there's no irritation from any foreign body in the eye. You see how nice and dilated the patient is, and that dilation will wear off during the day of the surgery. And some people see very well right away. Some people it takes a day or two for the vision to start to improve. And we're just removing the viscous material from the eye now, and this patient has a really good result and should get lots of vision back. Afterwards, you'll just patients just have to take eye drops for several weeks to prevent infection and decrease inflammation. And the total time of the operation usually is anywhere from 10 to 15 minutes, and patients usually do very well.